How to FUBAR a medical operation so thoroughly, everyone goes WTF. Medical procedures are serious, highly organized events, with trained professionals ensuring everything goes according to plan. But sometimes, the universe decides to throw in a wild card, turning an ordinary operation into a full-blown catastrophe. If you're wondering how things can go so sideways that everyone is left shouting WTF, you've come to the right place. Here's a guide to the most hilariously disastrous ways to FUBAR a medical operation so badly it becomes the talk of the hospital. Disclaimer: this is humor, don't actually try any of this. 1. Lose the patient's chart and wing it. Why waste time reviewing the patient's medical history? After all, you're a professional. Skip the chart and go straight for the gurney, except, wait, is this the right person? Who cares? If you start working on a hip replacement and realize it's actually an appendectomy, just throw in a freebie. A missing chart is the first step to glorious chaos. 2. Forget to sterilize the equipment. Who needs to sterilize the surgical tools? A little bacteria never hurt anyone, well, maybe a lot of bacteria. Make sure to skip this crucial step and watch as everyone gasps in horror post-op when infections start brewing like a biological time bomb. Bonus points if you mistakenly use gardening tools in place of scalpels. 3. Mistake left for right. When the consent form says left knee but you confidently go for the right one, you're halfway to becoming the star of a medical malpractice lawsuit. Double-checking is for amateurs, and besides, 2 wrong knees make for a perfectly symmetrical mistake. Just wait for that moment when the anesthesia wears off, and the patient realizes you've given them the wrong leg treatment. WTF indeed. 4. Use Google for surgery advice. Mid-operation and hit a snag? No problem, just pull out your phone and Google it. Bonus points if you loudly ask your assistant to check WebMD for some quick troubleshooting. Nothing inspires more confidence than the surgical team crowdsourcing an answer to how to reattach this artery, while your patient is open on the table. 5. Call for pizza mid-surgery. What's a little multitasking? Midway through a complex brain surgery, stop to call in a pizza order. Better yet, do it on speakerphone so the entire team can weigh in on toppings. While you're at it, throw in a comment about how this is just another routine day while poking around the frontal lobe. A little levity never hurt anyone, except when it does. 6. Forget the anesthesia. Oops. The patient starts moving, and you realize, whoops, the anesthesia didn't quite kick in. What do? Do you stop? Of course not. Just tell the patient to hang in there and soldier on while they writhe in semi-conscious horror. Extra WTF points if you tell them, this happens all the time. 7. Inject the wrong anesthesia. Why settle for a smooth operation when you can have a patient wide awake and horrified on the table? Instead of administering the correct anesthesia, hit them with something totally unrelated, like a double shot of saline, or worse, something that makes them hyper-alert. Nothing says WTF like a conscious patient watching their own surgery. 8. Get your intern to lead. You've got an eager intern watching the operation, so why not let them handle things? Hand them the scalpel, step back, and casually say, "You've got this." Watch as the room fills with panic when the intern realizes they definitely do not have this, especially when things start bleeding in ways textbooks never explained. 9. Mix up medications. Is it time for a painkiller or the sedative? Why not both? And while you're at it, accidentally switch those out with the patient's blood pressure meds. No one's going to notice until things go way off the rails. When the monitors start beeping uncontrollably and the patient starts speaking in tongues, just shrug and say, WTF is happening, like you're just as confused as everyone else. 10. Invite the whole team for a photo op. Why not capture this moment of surgical glory? Right in the middle of a delicate procedure, pause for a quick selfie with the team. Post it to Instagram with the caption, "Just saving lives, NBD." The patient won't mind, and the rest of the world will definitely go WTF when they see how casual you are about organ transplants. 11. Misplace an organ. Oops. It looks like a kidney, but wait, did you leave it on the tray, or did it fall on the floor? Maybe it's under the bed? Losing track of vital organs is a sure way to FUBAR the situation beyond recognition. When it's time to sew everything up and you realize you're one organ short, just laugh nervously and say, "We'll find it later." 12. Blame it on Mercury retrograde. When all else fails, blame the stars. If the operation is going up in flames and every decision you've made has been worse than the last, just tell everyone, it's Mercury in retrograde. Everyone will nod in understanding, as if planetary motion could somehow excuse the train wreck that is your surgical disaster. 13. Make it a game of operation. Forget meticulous care, instead, turn the entire procedure into a live-action version of the classic board game Operation. Buzzers, flashing lights, and loud noises every time you touch the wrong spot. Sure, the patient's life is in your hands, but wouldn't it be fun if you made it a little more like a carnival ride? Bonus WTF points if you actually hum the theme song as you go. 14. Invite an audience of non-medical professionals. If you really want to add to the WTF factor, invite a crowd to watch the operation. Forget students or interns, call in people with zero medical experience, janitors, cafeteria workers, maybe even a guy you met at the bus stop. Have them cheer, offer unsolicited advice, or even take turns with the scalpel. 15. Start operating before everyone's ready. Time is of the essence, so why bother waiting for the scrub nurse, the anesthetist, or anyone who actually matters? Get those incisions going while people are still arguing over the music playlist or trying to find a missing scalpel. Nothing says professional like a chaotic rush to catch up mid-surgery. 16. Use the wrong procedure for the wrong condition. When in doubt, wing it. Performing a bypass surgery for a broken leg or giving CPR during an eye exam are excellent ways to get that collective WTF moment. Be creative, medicine is all about improvisation, right? Your patients might not survive, but they'll die with puzzled looks on their faces. 17. Go full DIY mode. Who needs precision instruments when you've got household items? Break out that box cutter for delicate incisions, or use kitchen tongs to handle internal organs. Nothing screams WTF like using a paperclip as a suture. For a final touch, ask for a hammer when it's time to reset a bone, for that old-school vibe. 18. Ignore the beeping machines. Those constant beeps? Total buzzkill. Silence them all, no one needs to know the patient's heart rate, oxygen levels, or any of those other boring statistics. Focus instead on your surgical artistry, ignoring the rising panic of the nurses as they desperately try to stop alarms from blaring. If something goes wrong, just blame it on a technical glitch. 19. Blame it all on the patient. After the operation has gone spectacularly wrong and everyone is staring at you in shock, the ultimate FUBAR move is to shift the blame to the patient. Maybe they moved too much under anesthesia, or maybe their organs just weren't where they were supposed to be. You're the real victim here. 20. Turn the operating room into a dance floor. This one's all about atmosphere. Instead of the usual sterile and focused or vibe, crank up the volume with some funky tunes, start a TikTok challenge, or get the nurses to perform a conga line while you work. Having Uptown Funk blasting during a heart bypass guarantees everyone's thinking the same thing. WTF is going on here? There you have it, guaranteed ways to turn a straightforward medical procedure into a headline-making disaster. Remember, it's all fun and games until someone leaves a sponge inside the patient, and suddenly, everyone's shouting WTF, on the way to the ER, again.
Hey there, fantasy and science fiction fan lovers. If you can't get enough of mystical realms, futuristic worlds, and thrilling adventures, then you come to the right place. By subscribing to Fantasy and Science Fiction at Story Nori, you gain access to an amazing collection of stories that will transport you to realms beyond your imagination. By hitting that subscribe button, you'll never miss out on the latest tales of wizards, time travels, space exploration, and so much more. Our channel is dedicated to bringing you the best in fantasy and science fiction storytelling, and we're always adding new and exciting content for you to enjoy. But that's not all. By subscribing, you'll be also becoming part of our incredible community of fellow fantasy and sci-fi enthusiasts. You'll be first to know about the latest content for the channel that you won't find anywhere else. So what are you waiting for? Join us on this epic journey into the unknown by subscribing to Fantasy and Science Fiction at Story Nori today. Your next thrilling adventure awaits. Hit that subscribe button and let the storytelling begin. Thank you for being part of our amazing community. We can't wait to share even more incredible stories with you.